This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Albisone 100 injection is a corticosteroid that helps in managing various health conditions. It is crucial for replacing insufficient hormone levels and alleviating inflammation. Indications and uses. This injection is indicated for a wide array of medical conditions, including endocrine disorders, rheumatic disorders, hematologic disorders, collagen diseases, dermatologic diseases, ophthalmic diseases, gastrointestinal diseases, respiratory diseases, and neoplastic diseases. Additionally, it serves as a replacement for insufficient corticosteroid hormones and is utilized in emergency situations, such as severe allergic reactions and shock. How it works. Albisone 100 injection functions by replenishing low cortisol levels and inhibiting the production of inflammatory chemical messengers in the body, leading to reduced swelling and pain relief. Directions for use. This medication must be administered by a healthcare professional, either as an intravenous injection/infusion or as an intramuscular injection. The doctor will determine the appropriate dosage and duration based on the patient's age, body weight, and specific medical condition. Possible side effects. Common side effects include pain and swelling at the injection site. Serious side effects may occur, and any unusual symptoms should prompt immediate consultation with a healthcare provider. Precautions and warnings. Before receiving this injection, it is vital to inform the healthcare provider of any existing health conditions, previous infections, or allergies. Special care should be taken for patients who are pregnant, breastfeeding, or have kidney or liver issues. FAQs. 1. What is Albisone 100 injection used for? It is used to manage various disorders and replace insufficient corticosteroid hormone levels. 2. What are the common side effects? Pain and swelling at the injection site are common. 3. How does it work? It replenishes cortisol levels and reduces inflammation. 4. Who should avoid using it? Those allergic to hydrocortisone or with certain infections should avoid it. 5. Can it be used in children? Yes, but with caution and under medical supervision. Thank you for watching. If you have any questions or suggestions, feel free to comment below. Your feedback is greatly appreciated.